Welcome, and thank you for joining the Community Care Plan Provider webinar on Physician Payment for Uncompensated Care, PPUC program. To streamline operations, effective March 1, 2019, Broward Health partnered with Community Care Plan to administer the health benefits for Broward Health's Physician Payment for Uncompensated Care program. Community Care Plan is owned by Broward Health and Memorial Healthcare System and is a member of the Florida Association of Health Plans and the Association of Community Affiliated Plans, is fully accredited by the National Committee for Quality Assurance for 3 years on CCP's first attempt, and is fully accredited by the Accreditation Association for Ambulatory Healthcare as a health plan. CCP provides the following resources: PlanLink Provider Portal, electronic funds transfers, provider tutorials available on CCP's web portal at ccpcares.org under the Provider Academy section, provider orientation webinars, a dedicated member services team, provider operations team, and a dedicated medical management team. EpicLink provides real-time web access to patient information. PlanLink is a component of EpicLink. PlanLink provides the ability to review claim status, requests and/or status of authorizations, referrals, patient eligibility verification, and benefits. To register for PlanLink, or if you have any questions, please contact the Provider Operations Department hotline at 855-819-9506 or access the PlanLink web portal at the on-screen address. Provider training webinars are also available on the CCP website. From ccpcares.org, go to Providers, Provider Academy. Pre-authorization requests and supporting documentation may be submitted in the following ways: through PlanLink, fax to 954-699-0737, or email to ccp.fax.ppuc@ccpcares.org. Authorizations must contain all supporting documentation. For assistance with prior authorization, please contact 866-259-4272 or 855-819-9506. Claim submissions and electronic funds transfers. Please register with Availity at 800-282-4548 and use Availity Payer ID BHPP1. Claims should be submitted promptly after the service is provided. Providers have 90 days from the date of service to submit clean claims in accordance with the contract. Claims must be submitted within 90 days after the final determination of the primary payer. In order to process an electronic funds transfer, the provider must complete the EFT form in its entirety and submit a voided check. The completed EFT form and voided check should be submitted via email to eftforms@ccpcares.org. The estimated turnaround time to process a completed EFT application submission is currently 45 calendar days. If there are any changes to the submitted information in the future, Please notify our finance department by submitting an email with the changes to the EFT email noted above. Claims appeals must be submitted in writing within 30 calendar days from the date of the EOB using the appeal form or submitting an appeal letter to CCP. The appeal request must include a complete appeal form or letter available on the CCP website under the For Providers menu using the on-screen address. Include supporting documentation and a copy of the original claim. Appeals should be mailed to the on-screen address. Service appeals must be submitted in writing within 30 calendar days from the date of the Notice of Action letter by submitting an appeal letter to CCP. The appeal request must include the completed appeal letter, supported documentation, and a copy of the original NOA letter. Appeals should be mailed to the on-screen address. Providers should notify CCP of administrative changes prior to 60 days of change, such as change of location, mailing address, phone number, tax ID, practice name, or practice closing, adding or terminating a provider from the practice, adding or closing a service location, changes in a provider's hospital privileges, termination from Medicaid, license suspension or termination, and exclusion from participation in federally funded programs, or changes to MPI. You can submit your changes to the on-screen contact information. CCP will be providing updates, additional tools, and resources as they become available. Provider tutorials with additional process tips will be available on CCP's web portal located at ccpcares.org. Please visit our website or use the Provider Relations Hotline at 855-819-9506. Thank you for your continued support. This concludes the Community Care Plan Provider webinar on the Physician Payment for Uncompensated Care Program.